This interview is with Carla Mazzone. Carla has been a registered nurse since 1984, where she was originally involved in hands-on hospital nursing. Within the last several years, Carla has been involved in cancer research, where she currently manages and oversees patients who are on or possibly eligible for clinical trials. Carla will discuss in detail some of the different cancer treatments and side effects, as well as their impact on business and personal relationships.
Many people feel that when you have the diagnosis of cancer, everyone gets the same drugs on the same schedule and has the same side effects, and this is not true. We have different drugs that we give to breast cancer patients, different drugs that we give to lymphoma patients, to colon cancer patients. We may be treating patients that have cancers that cannot be removed for one reason or another, and that have gone beyond the site of where the cancer originated to other parts of the body, and those treatments are typically longer. And so I think that's important for people to know that there's going to be different drugs, different experiences among people, because everyone's situation with their cancer is usually very different. We call giving the drugs a cycle of therapy. And for example, maybe for a breast cancer patient, she may get 2 drugs once every 21 or 28 days. And so we're giving her chemotherapy 1 day every 3 to 4 weeks. Other patients may get chemotherapy 5 days in a row and then have 2 or 3 weeks off before we treat them again. Some patients are getting chemotherapy in combination with radiation therapy, and in that instance, they normally get radiation every day, Monday through Friday. They have the weekend off, and then they start over with their radiation Monday through Friday again. However, a patient who has cancer in his body that has gone to other sites in his body, we typically will give them treatment maybe indefinitely, as long as we are helping the cancer, as long as we are keeping the cancer at bay and the cancer is not growing. So we could be treating a patient for a year and a half, depending again on the drugs that we're using and how well the cancer responds to what we're doing. It's important to realize that chemotherapy will affect each person differently. The drugs that we give them can have anywhere from mild to severe side effects depending on the person and the drug. Some experience mild nausea, which is kept in check by some excellent drugs that we have to relieve nausea. Some have prolonged nausea just because of the type of drug that they receive has a higher propensity to cause severe nausea. And so they may find that food, even the smell of food, makes them queasy or makes them nauseated. So there may be weight loss, which is something that we don't like to see. We like to keep the patients maintaining their weight, and we do our best to do that through food supplements and other means that we have. But you may see at work a patient in the lunchroom that maybe sits far apart from everyone else because maybe the smells bother them, or maybe they just don't have an appetite at all. Another side effect that is frequently experienced by patients undergoing chemotherapy is fatigue. Fatigue is exacerbated by not only the effects on normal tissue, because the patient's body has to repair that normal tissue through good nutrition, but also because the patient experiences low red blood counts. And those red blood cells are the cells that carry oxygen to the rest of the body. And if those counts are low, there's not as much oxygen circulating, and the patients do get fatigued. Inattentiveness and short-term memory loss can occur with patients undergoing chemotherapy. For one instance, depending on the type of drug they receive, some drugs are mixed in an alcohol base. And during their treatment in the office, it can make them feel woozy, which carries on for a day or so afterwards. Also, the inattentiveness can be related to emotional feelings. These patients come in with a diagnosis of cancer, and it's a whole new world of medical jargon that we throw at them. we're giving them drugs that have incredibly long names that we want them to remember that they are getting. And we talk to them about side effects. We talk to them about how to best take care of their bodies, mouth care, hair care, skin care. We give them pamphlets and expect them to remember when to call the doctor and when not to call the doctor, or when do they need to come in. There's so much information that we throw at them that much of the inattentiveness or short-term memory is just because they are just overloaded with information and there's just too much. And we are constantly reinforcing when they come into the office things that they need to remember. A very, very important side effect that we deal with, or that we really talk in depth to the patients about, are the side effects that occur when the chemotherapy lowers your white blood cell count and your platelet count. Lowering your white blood cell count affects how susceptible these patients are to everyone else's germs. When their white count is low, these patients are much more susceptible to colds and flus and bacterial infections. If they work in a large, crowded office where there are no walls or partitions that divide one person from another, where coughs are spewed across the room, it could be a hazard for them, especially during certain time points in their chemotherapy when their counts are at the lowest. They want to avoid crowds usually during those times. Avoid people that are coughing or sniffling or who have been exposed to grandchildren or children that have recently had strep or any kind of other infection. It's a very critical time for them. You can get what we call a neuropathy, or a sensory deprivation of feeling or pressure in the fingertips or in the toes, and it may make people that do very fine motor skills with their work, it may make their work very difficult. It also can affect their ability to walk. We've had patients that develop very sore feet and need assistance, use of a walker. Not all drugs do this, but we have a couple that we give frequently for many types of cancer that can cause this problem. The side effects of the drugs usually will diminish after the patient stops the drugs. As long as a patient is taking the therapy, whether it's radiation or chemotherapy, and he's experienced side effects, those side effects will probably be present during the length of his treatment.